Magnetic resonance imaging MRI patterned recognition of metabolic and neurodegenerative encephalopathies in dogs and cats. Introduction. Overview of metabolic and neurodegenerative encephalopathies in veterinary medicine, highlighting their complex etiology, which includes both endogenous malfunctions, metabolic imbalances, and hereditary neurodegenerative disorders. Definition of these diseases, which share common clinical signs and MRI features, complicating the diagnostic process. Purpose of the study: to describe MRI characteristics in a large sample of dogs and cats, and to develop a pattern recognition system for classifying these diseases based on their imaging profiles. Study objectives: to document and classify MRI findings in confirmed cases of metabolic and neurodegenerative encephalopathies, to establish an MRI pattern recognition system to aid in the diagnosis, to correlate findings with previously published literature, materials and methods. Study population. Sample size: 100 cases, 81 dogs and 19 cats, collected from 17 veterinary referral institutions. Inclusion criteria: animals presenting with neurological signs and MRI-confirmed brain abnormalities. Diagnostic confirmation: laboratory tests, genetic testing, histopathology, or clinical improvement after treatment. Data collection: MRI images were reviewed using DICOM viewing software, with 2 board-certified radiologists assessing each case. Imaging sequences: T2 weighted, FLAIR, T1 weighted, pre- and post-contrast, and diffusion-weighted imaging DWI-1 available. Anatomical map was designed to guide the review of MRI data, ensuring systematic evaluation of brain regions, cortex, white matter, thalamus, cerebellum, etc. Classification parameters: evaluation of brain volume, normal, increased, decreased, and predominant lesion distribution, gray matter, white matter, or both. Lesion patterns based on signal intensity on T2W, FLAIR, and T1W sequences. Analysis of specific metabolic and degenerative diseases: hepatic encephalopathy, thiamine deficiency, myelinolysis, lysosomal storage disorders, Lafora disease, and intoxications. Results. General findings. Species breakdown: dogs presented with a broader variety of conditions, including lysosomal storage diseases, 11 dogs with neuronal ceroid lipofuscinosis, 13 with L2-hydroxyglutaric aciduria, while cats more frequently presented with thiamine deficiency. MRI characteristics: bilateral, symmetric lesions were typical for most conditions, particularly those involving metabolic disturbances, with variation in the involvement of gray and white matter. Hepatic encephalopathy: a total of 23 cases, 20 dogs and 3 cats, with confirmed hepatic encephalopathy. Typical MRI findings: forebrain atrophy, in 18 out of 23 cases, particularly affecting the centrum seminal valley, internal capsule, and cerebellar nuclei. A unique feature: cerebellar involvement in 8 cases, which has not been commonly described in prior studies. Myelinolysis, osmotic demyelination syndrome. 5 cases presented with bilateral symmetric lesions affecting the thalamus and subthalamus. A novel observation: involvement of the superior longitudinal fasciculus, a white matter tract not previously noted in veterinary literature. Thiamine deficiency: involvement of deep gray matter structures such as the oculomotor nuclei, caudal colliculi, and red nuclei in both dogs and cats. Cats with thiamine deficiency often presented with additional cortical abnormalities, likely related to a history of seizures. Hypertensive encephalopathy: 5 cases show diffuse white matter changes, more marked in cats, with brain swelling and mass effect. In dogs, lesions primarily affected the parietal and occipital lobes, consistent with posterior reversible encephalopathy syndrome pres in humans. Lysosomal storage disorders: a large number of cases, including neuronal ceroid lipofuscinosis, 11 dogs, gangliosidosis, 5 animals, and fucosidosis, 1 dog. Common features: severe brain atrophy with marked white matter hyperintensities. Some cases displayed pachymeningeal enhancement, previously unreported in veterinary cases. L2-hydroxyglutaric aciduria: 14 cases presented with classic imaging signs: thickened cortical gray matter and involvement of deep gray matter structures like the thalamus, subthalamus, and cerebellar nuclei. These findings align with previously documented patterns in both veterinary and human medicine. Lafora disease: 11 dogs were included, presenting with mild brain atrophy. Notably, none showed signal changes in the substantia nigra or dentate nucleus, regions known to be heavily affected by Lafora body accumulation in human cases. Discussion: MRI patterns and clinical correlations. This study identified distinct MRI patterns for metabolic encephalopathies, e.g., hepatic encephalopathy, thiamine deficiency, and neurodegenerative diseases, e.g., lysosomal storage diseases, Lafora disease. The establishment of pattern recognition systems based on MRI features allows clinicians to refine their differential diagnosis, often providing critical clues to disease classification before genetic or histological confirmation. Novel findings: several novel MRI findings were reported, such as the superior longitudinal fasciculus involvement in myelinolysis, and cerebellar nuclei involvement in hepatic encephalopathy. Differences in the severity of brain atrophy between species, especially in conditions like cerebellar cortical degeneration, where dogs showed more severe atrophy than cats, were also noted. Implications for clinical practice: this study highlights the importance of high-field MRI in early diagnosis and treatment planning for these complex conditions. The pattern recognition approach can streamline the diagnostic process, especially in cases where biopsy or genetic testing is not readily available. Limitations: The retrospective nature of the study and the variability in MRI protocols across institutions introduce challenges in standardizing the findings. Additionally, small sample sizes for some conditions, e.g., fucosidoses, may limit the generalizability of the conclusions. Conclusion: the study successfully outlines MRI features that can be used to develop a pattern recognition system for metabolic and neurodegenerative encephalopathies in dogs and cats. This system allows for stratification of differential diagnosis, facilitating earlier interventions and improved prognostic outcomes. Future prospective studies and standardized MRI protocols across institutions will enhance the accuracy and utility of these diagnostic tools in veterinary practice.